The Kenya Medical Practitioners and Dentists Union, that's KMPDU, will today assess Kisumu County preparedness on COVID-19, a day after the board alleged that some of the members had been infected by the virus while handling victims. This also falls in the backdrop of the vigorous tracing exercise of one possible contact of the Siaya case, which we told you earlier about, where public officials have been combating various areas to round up contacts. Laura Etienne is now joining us and she tells us more. Laura, it's great to see you this morning. Do you know whether the KMPDU officials have begun taking their rounds in Kisumu?
Well, indeed, Zinzi, the officials are currently at a closed-door meeting with the Kisumu County government to basically discuss some of the issues that are affecting them as health workers. Because last week also, the Kenya National Union of Nurses had called on the county government to avail personal protective equipment, which they said were lacking. And of course, those allegations yesterday by the Kenya Medical Practitioners and Dentist Union, alleging that some of its members had actually contracted the virus due to their frontline activities in combating the disease. But right now at the Jomo Kenyatta JOTRH, that is Jaramogi Oginga Odinga Teaching and Referral Hospital, screening services are ongoing. This has been ongoing since the outbreak of COVID-19 in the country on March 13th. And health workers basically here, all of them are donned in personal protective equipment. But then the concern is that inside the hospital, inside the various isolation facilities, there are not enough of those PPEs. So of course we are waiting for KMPDU to give a comprehensive statement on what they would have agreed on with the county government. And also residents in Kisumu are operating on high alert after public officials come through various areas to round up possible contacts of the Siaya case, where a man succumbed to the new coronavirus. But then as of now, people are wearing masks similar to what I'm wearing right now, which is a 3-layered mask made by various women groups across the slum areas mostly. They are MOH compliant with the 3 layers, and also we are seeing increased compliance in public transport, where matatus are now observing the 50% capacity carrying of passengers, as well as border operators increasingly carrying sanitizers and wearing masks and ensuring that the pillion passengers is just 1 pillion passenger who is basically wearing a mask. So of course we're waiting to see what KMPDU Nyanza branch will have to say about the preparedness of the county, and what the county will also be putting in place to ensure that health workers are protected against infections of the new coronavirus in their frontline battle in combating the virus, Zinzi.